This broadcast is brought to you in part by the One Love Bus Tour. The One Love Bus Tour, feel the pulse of Negril, one love, one bus, one adventure. The Lighthouse Inn 2, West End Negril. The Lighthouse Inn 2, where only paradise is more beautiful.
And this clinic has helped him a lot. Both for the brace, the splint, the wheelchair, everything. Because I can't afford it. And if I have to buy him the brace, just to get a simple little brace, not even the one that he wants, it costs $350,000, and then he's going to grow out of that brace. So you can imagine.
Oh, don't get too tearful. Oh my God. It's a pleasure. Stop, don't cry. You're going to make me cry.
That way, he can straighten his legs,
put his legs on the thing, and it stops his legs going.
Put
his leg up on the.
The patients we see, we get majority of them from Bustamante Hospital.
The Negril Paediatric Orthotic Services Clinic has been a beacon of hope for children across Jamaica since 2009. Housed at the Negril Health Center on Nomprel Road, this clinic provides essential orthotic care, transforming lives free of cost. With specialized braces donated by families in North America, the clinic serves children suffering from conditions such as spina bifida and cerebral palsy. Each year, hundreds of young patients receive custom-made lower limb braces, a crucial lifeline for many. At the heart of this initiative is retired intensive care nurse Elaine Bradley, who has coordinated this clinic since its inception.
So this is the Paediatric Orthotics Clinic. Paediatric spells English. And this has been going since 2009. We have seen now maybe almost near to 400 patients since then. And we do follow-ups because as the kids grow, we need to change their brace because obviously the feet will be in different positions. The patients we see, we get majority of them from Bustamante Hospital in Kingston, which is the largest Caribbean children's hospital. So I work very closely with Dr. Saul and all his other doctors, like Dr. Charlene, Dr. Prince, and all of them. And also they can be referred. No patient can just walk in. They have to be referred by a doctor, a physiotherapist. Sometimes the early stimulation, they will send us patients as well. And we don't choose. Our cutoff is 8 years old. But we have got patients, I think our oldest one is about 17, going to Rossi's, and she still come to see us because they can't get any brace anywhere to fit her. And sometimes because she's outgrown us, the brace breaks. We do find a brace to fit her from time to time, but we don't like to say bring teenagers because even though we have the odd few, the ones we have really that are older than 8 is ones we've been seeing when they are about 18 months. Like Miles, we've been seeing Miles from he was very young. Because it's better to get the kids when they're quite young. Their bones are still malleable, and so we can adjust the brace and help to mold the bones in the proper way it should grow.
Under her leadership, the clinic has partnered with volunteer orthotic specialists from the United States and Canada, who visits 4 times a year to offer their expertise. These specialists, hosted by Rio Resorts, retrofit braces that range from $1,600 to $8,000 US, all provided free of charge to Jamaican families. Over 300 children have already benefited from this life-changing care.
Cerebral palsy, tippy toes, club feet. I won't say talipes equinovarus because that's actually a more complex form of club feet. So we normally see a lot of bow legs. We normally see them as well. This maybe look like a simple brace, but as I said, a lot of patients who have maybe club feet or deformed feet, there are different ranges of deformity, and so each brace has to fit that particular deformity. So you might come in here and say we have tons of braces. It's not as simple as that. You can just pick one off. The specialist looks at the one that's nearest to the child's deformity, or I wouldn't say deformity, yes, deformity, I can't think of any other word. And so they would look at the nearest one, try to fit it on the child, and then if it doesn't, we go to the workroom and we shape it to the child. We heat it up and put it for a specific child. Because all these braces are individually made for a kid somewhere in the States or Canada. And then they come here, we have to fit them to our children. So it's like we are making an old brace new for the different type of deformity.
Parents expressed their deep gratitude, noting that without the clinic, the cost of braces would be far out of reach.
My name is Shelley Stewart. This is my son Miles Brown. And I am so grateful for this clinic because Miles has been coming here from he was a baby until he's going to be 8 years old this year. And this clinic has helped him a lot. Both for the brace, the splint, the wheelchair, everything. Because I can't afford it. And if I have to buy him the brace, just to get a simple little brace, not even the one that he wants, it costs $350,000. And this clinic has helped him a lot. Both for the brace, the splint, the wheelchair, everything. Because I can't afford it. And if I have to buy him the brace, just to get a simple little brace, not even the one that he wants, it costs $350,000, and then he's going to grow out of that brace. So you can imagine, grow out of that brace and I have to replace it. The splint, I have to replace it at each time. So I have to just come right here.
And how much you pay here?
Nothing. Nothing. I'm getting the brace, I'm getting the wheelchair, I'm getting the splint, I'm getting everything. And you know what the next thing about it? They call you to check up on the patient. And that is very nice. How is he doing? All those things.
And you tell them that you get telling off as well if you don't do the stretching and the thing. You get that on top of it.
On top of everything. Yeah, man is excited to come each time. Hi, my name is Nardi Reed Williams. I'm from Lynn State, St. Catherine. My daughter is a patient at the orthopedic clinic. She was recommended here by Dr. Saw, her head doctor at Osamanji Hospital for Children. Right. So coming here over the past 11.5 years, it has been, the hardest part is the traveling, the length of the journey to get here. But once I'm here, it's always a warm welcoming. I'm always satisfied. They treat us as if we're part of their family. So I'm pleased for the past years that I have been taking my daughter here to this institution. It has cost me less. It has taken a lot of expenses off me in terms of she getting the braces to fit in the shoe. There are times when I get here, the shoe that I come with, the brace can't fit in there and she gets a shoe. So I'm pleased with the service that they are offering. I hope God will allow them to continue for other babies to come and parents to have this experience and to enhance in the, what they would say, less cost-effective procedure. So she had severe club foot. Yes, so we had to do a surgical spot in order for her to be flat-footed. So it's a process. She started the procedure at 1 week old, and it's a constant follow-up until now. She's 11.5 years. Moving around, she's very flexible and everything. So based on where she was to where she is now, I am pleased with the whole entire process of her medical issue.
My name is Katrina Walters. I'm from Negril, and I really appreciate what the Negril Health Center have done for me. It's been a wonderful day, and my son, I'm very pleased with whatever I get here, so that you can help us. Thanks. The shoes is very, I know the shoes is very expensive. And they gather the shoes, the wheelchair, I know it costs a lot of money. I got it down here for free.
Oh, don't get too tearful. Oh my God. It's a pleasure. Stop, don't cry. You're going to make me cry. It's a pleasure.
This broadcast is brought to you in part by the Lighthouse Inn 2, West End Negril. The Lighthouse Inn 2, where only paradise is more beautiful.
We are here to help. And we are only in the grounds of the health center. This is an independent clinic running out of the grounds of the health center. We pay rent for this. And the Rio, thank God for the Rio Hotel, they pay the rent for this cottage for the use, and they also put up the specialist that comes. And if it wasn't for Rio doing this, you would not have this facility. And all I have to say, I am very grateful to them for allowing me to be able to help some of my people. So we are doing our little bit here to help the people who want help. And these kids that we help and the parents, we know it goes a long way.
Rio Resorts has also been instrumental in supporting the clinic since its creation in 2009, providing funding for staff, space rental, and maintaining the clinic's operations. Rio Resorts hosts the volunteer specialists during their stay in Jamaica, further contributing to the local community.
Rio puts up the specialists when they come, however many of them come at one time, Rio has always put them up. Occasionally when Rio has not got any room, I have put them up at my house. About all the time we're doing it, I think I've put them up at my house about 4 or 5 times since 2009. But Rio has always accommodated them. And I have to do all the arrangement to pick them up at the airport, take them back to the airport. I go pick them up at Rio every morning, bring them back to Rio every afternoon when we finish clinic. Sometimes we are here at clinic till from 9 o'clock till 8 o'clock at night because patients come from far and we will not leave until every patient is seen and satisfied. So however long it takes us, we are here to pamper to their needs.
Negril, I'm a pediatric orthotist from the United States. We've been going to Jamaica for 9 years now, at least 2 to 3 times per year to bring these used bracing that we have from our patients in the US when they outgrow it, and bring it down here and help it to children in the area here. And because kids are growing and changing all the time, we have to see them back over and over to try to make sure that what we gave them is still fitting, or if it's not fitting, then we have to give them the new next size up. We come here for clinics usually 2 times per year, every spring and fall, and most kids will outgrow their bracing within 6 months to a year. So we either see them back once a year or sometimes twice a year if needed. Well, I work with children providing bracing in my practice in the United States, and I know how important it is to see them as they grow to help prevent deformity as they grow. And so we try to help take care of the same children because you can't just see them one time and then they're all cured. We have to continually see them as they grow and help them to continue to manage their condition and help them to get the most progress that they can get to get better and stronger. So what we try to do is 3 different things. The first one is to help children improve their function. So sometimes when kids come in, they can't stand very well or walk well, and so we give them a brace to help them improve their function immediately. The next thing that we're always looking at is helping them to develop properly as they grow. When they 5 years from now or 10 years from now, we want their bones and joints to grow properly, and in order to do that, we have to hold the muscles and the bones in the correct position. And the third thing is preventing deformity from occurring. So that means, again, holding the bones and joints in the correct position and keeping the muscles stretched out is very important. We see a lot of times children are having difficulty with their muscles not being loose enough, and so we have to keep them stretched out in order to prevent deformity. Well, we're just very blessed to be able to come here and do this, at least 2 times a year, and very thankful that Ryu helps to support this clinic and support us when we come, so that we can stay and just do all the work that needs to be done in order to help us continue for not only the patients we're seeing now, but we still get new patients all the time that just are learning about the clinic and just needing the help that we have to offer.
All the lower extremity deformities we will see. Now sometimes patients don't just need lower extremity brace devices. Sometimes they need a body brace, because some of them will come and their torso is very weak, so they are floppy. So if we have anything in our clinic that can fit them, we will do. Primarily though, our objective is to fit them with lower extremity devices. But because we get patients, some of them have had stroke in vitro, and so they come and sometimes one side is a bit lethargic or a bit, I don't like to say deformed, but one side maybe is a little bit not right. So we try to help them by giving them some elbow brace, we give them wrist brace, and we give them stress balls so that they could do exercises for their fingers and hands. So whatever device we have in here that we think can help the kid, we will do that. And our specialists, when they come, they are open-minded. So they will go back and they said, oh, we saw this kid that could do with such and such a brace, and they will bring it. Well, the cost for the simplest of these braces is about $1,800 US. Just a very simple one. And that's for one leg. So imagine when most patients, there are 2 feet that are, challenged. So think if they have to pay out for that.
The Paediatric Orthotic Service Clinic in Negril stands as a testament to the power of collaboration and compassion, improving lives one step at a time.
With a message of light, peace, and love from a higher astral up above. The humanitarian, I come with my music. The humanitarian, music for salvation. The humanitarian, a creator's permission.